Hello, everyone. My name is Trinity Upshaw, and I am a senior biology major and Spanish minor at Fisk University. Today, I will be talking to you all about a 2-year project that I have been working on with the HBCU Wellness Project entitled Breast Cancer Awareness and COVID-19 Among African American Women. First, I will give you all a little background on breast cancer. Breast cancer is a disease that is the second leading cause of death for women. And for African American women specifically, it is the most common type of cancer. Also, patients who suffer from breast cancer have a higher risk of developing COVID-19 due to their immunocompromised systems. A goal for this study was to recruit African American women 18 years or older in the Nashville community to participate in an informational event to educate participants on ways to increase awareness and lower risk of breast cancer. The purpose of this study was to raise awareness of this health disparity among African American women in the Nashville community. Also, another goal was to shed light on the consequences of late detection, family history significance, lack of resources, such as health insurance, and the availability of treatment options. Finally, individuals from underrepresented communities can have a better prognosis with more knowledge of the disease and identify where care can be obtained. As far as the methods that were used to facilitate this event, to begin, participants were solicited through the GroupMe app. Next, participants attended a virtual educational event via Zoom where they were giving a pre-test upon arrival. Then, a breast cancer researcher facilitated the session where guests were allowed to gain knowledge on breast cancer awareness regarding the disease, including ways to lower risk, and encourage participants to complete annual breast cancer screenings, since studies show that early detection saves lives. Furthermore, a breast cancer survivor was able to share her experience dealing with the disease. And lastly, a physician spoke about the correlation between the increased risk of COVID-19 in women and men with breast cancer due to their immunocompromised systems. Finally, they were issued a post-test to find if there was a change in knowledge. And here is a slide of the results. So overall, there was an increase in scores as it related to the pre- and post-test knowledge that was obtained throughout the presentation. For the pre- and post-test, participants were asked to respond to several questions that related to breast cancer and its correlation to COVID-19. Two of those questions asked the following. Number one, what place is breast cancer in as far as the leading cause of death among women? And number two, does having breast cancer increase your risk of developing COVID-19? Over to the right, you will see the results for both the pre- and post-test responses to these questions. There was an 18.9% increase in correct responses regarding breast cancer and a 28.3% increase in the question regarding COVID-19. By creating a virtual event for the African American women in the Nashville community focused on breast cancer, this provides awareness to a demographic that is rarely targeted. Also, with breast cancer basics and mammogram timelines, this knowledge can assist participants with possible early detection in the future. The correlation between breast cancer and COVID-19 can then help patients understand their elevated risk for catching this virus. And lastly, by doing this research, I was able to understand the importance of not only early detection, but ensuring that one takes the appropriate measures to guarantee life longevity. And lastly, I would like to give a big thank you to my community partners, which are Fisk University, Meharry Medical College, the Tennessee and Meharry Medical College HBCU Wellness Project, Dr. Heather Beasley, Dr. Judith Presley, Dr. Shakulia Cartler, and Dr. Kenya Miles. Thank you.